Hey everybody, I'm Jay. I'm a transgender male, and this is my 10th month on T, and also I'm about 5.5 weeks post-op, or nearly 6 weeks post-op. With Dr. Garramone, I'm going to do a 10-month update because I have a little bit to say about that, and then I'm going to do a little bit of post-op stuff about how I'm doing with after surgery. So if you're interested in after surgery, I don't know, I think it'll be a couple minutes before I'm done with the update. So anyway, um, about the update, my voice. There's been I think my voice is stabilized. It's not nearly so hoarse anymore. And also, I have periods of time where I'm not hoarse at all, which is really good. I'm really was so tired of being hoarse. Um, so it's the amount of time that I'm not hoarse is increased. I think I have a little hoarse right now, but anyway. Um, I'm not really a singer. I mean, any nearly professionally or anything. I've sang in the choirs before, and I'm pretty sure that I'm in the tenor in the baritone range, which is rather interesting. I think that's one reason I may be having a little trouble with my voice. Is I think I can go actually lower than I think I can, or something like that. Anyway, hair. I think I'm getting some stomach hair. I don't know. Um, we'll just follow that, see how that one goes. My doctor seems to think that maybe I'm not ever going to really get body hair too much. And I think the reason it's going up from the pubic area, so that's why I'm getting body hair there, but I'm not really otherwise. Um, Hair on my face. I'm getting some here, which is still pretty light and sparse, and it's getting a lot thicker on my chin, very much thicker. I think it's still too early to start dyeing it to see if it would bring it out at all. And then my mustache, I'm not even using the dye half the time. Um, I could still use it, I think. I didn't today, so anyway. Um, Sex drive is a little better. Not as bad, I should say. I'm like my dose of tea is reduced. I don't know how much I talked about that, but I have I was getting kind of like at a level that could be toxic, so she reduced it. So um, I don't know what it is right now. I'm pretty sure when I see her again, she'll want to do another test because she does this kind of thing. Anyway, muscle strength and all that. Obviously, since I just had top surgery, I wouldn't really know about that. I, have been, not really lifting very much. Redistribution of fat. The top surgery has allowed me to see my hips really better. I still have a bit to go, but they're still they're better than they were. I mean they're less prominent, let's say, than they were. Um, and then my face, it I think it's continued to change somewhat. The amount I'm passing is very high. I don't know. It's probably from top surgery somewhat because it changes your profile a bit. But anyway, I think it's close to. I'm being read as male. Um, where so often that it's very unusual when I'm not, but it still is happening. The other day, and it was really like everybody else was reading me as male, and this guy comes and I drop something, and he says sir or something, and then he sees me, and then he says ma'am, and I'm like, what's up with that, So that was, I don't know. Anyway, doesn't happen too much. Now I'm going to show you my chest. So first of all, my range of motion. Ooh, look at that. Now I'm starting at right here is where I feel pulling. If I move up higher than that, okay. And obviously it's pretty wide, normal. So here we go. It's my chest. Ooh, let me just take this off here for a second. Okay. Now here's my whole chest. Let's see, that one, there's that part of it, and here. Now, and then my right nipple and my left nipple. Okay. Now, I started using ScarGuard. I don't know, you probably can't see that in the picture, but it's the strips or the sheets were curling up, but I don't like ScarGuard either. It's not the peeling, which I've heard of before. Why isn't anybody talking about the smell of that stuff? It is totally awful. Now it does dissipate, but it still sticks on way longer than I'd like it to. Anyway, so I've got another idea here, but anyway. So here's the incision line. I think this under the arm here looks good, but I don't really like this so much. I don't know what's going on there. I am getting some swelling. So this one is not as swollen as much as this one. And you can kind of tell by the position of the nipple that it's swelling more on this side. I don't know, maybe I'm overcompensating for being right-handed. I don't know. The nipples are looking really good, I think. The nipple itself is coming out. You can kind of see that. And I think they feel a little hard or something. Like they might have a scab on them more, some more. Or I don't know, maybe that's just how they are. They're different than, natural, I guess, is what I'd say. But maybe that, goes away, kind of changes in time. Feeling is, I said last time that I thought I didn't have any loss of feeling. I do right on the incision line and a little above and below. More so here than here. This is more. And then I've got feeling all here and in between and all that. And then the nipples themselves, I don't have any feeling in them. Well, I think I do a little bit, like right on the edges, but I don't know whether that's from skin behind it or what, that is, Anyway, so, okay, that's it for today. Thanks very much for watching. In a couple of weeks, I'll do another update and maybe back to a topic of some kind. I don't know. And anyway, check me out on It's a Man's World, FTM1, where I update on Thursday, but I don't know, most of you probably wouldn't get it till Friday. Okay, thanks for watching. Bye.